Low back pain is a near universal problem in the modern world, and most of it just comes from lack of regular spine movement as a whole. This is especially true if you work at a desk all day. So if you want to deal with your low back pain right now, here are the 4 most commonly neglected spine movements you probably need to do more of. Number 1, twisting. Twisting, or trunk rotation, develops the transverse abdominis, a vast corset-like muscle connecting our rib cage to our hips. Transverse abdominis is maybe the most important muscle to train for overall spine health and mobility. Yet most people are very weak here unless they do a sport like kayaking that requires transverse movement on both sides. Because the transverse abdominis connects to so many things, the adhesions and stiffness that sets in when it's not moved regularly can make what should be a supportive but flexible corset feel like a straitjacket. Even worse, people who play sports like golf or tennis, which do feature transverse movement but mainly or exclusively to one side, tend to overdevelop one side of the twisting motion while neglecting the other, which sets up chronic overuse injuries of the back and shoulders. This makes practicing rotation to the opposite of your dominant side crucial to longevity in these sports. The safest way to start developing transverse abdominis is to practice twisting from a seated position. Squeeze and hold your butts and guts, bring your arms up like this, and begin twisting slowly to one side. Stop at the first sign of tightness, restriction, or pain, and hold this position for a few seconds at or near the pain point, no higher than 3, and then slowly twist to the other side and repeat. Each time through, push a bit deeper into the twist so long as your pain doesn't go above 3. For progression, keep your head in neutral to add more leverage. You can perform this movement standing as well, just make sure to limit movement of the hips so transverse abdominis continues to be the featured muscle. Finally, add a band for more resistance. The band limits your movement but increases the tension, which has the effect of pulling you deeper into the stretching component of this exercise without having to twist so far into it. Number 2, tilting. Tilting, or side bending, strengthens lateral flexion of the spine, which supports static postures like standing or sitting, as well as quick lateral movements in sports like basketball, soccer, or boxing. Like twisting, tilting can start from a seated position and perform the same way. Clench butts and guts, lift your arms up, and begin tilting slowly to one side, stopping at early signals of tightness or pain, and holding an isometric contraction for a few seconds until the signal fades, then switching to the other side. Each time through, try to push deeper into the tilt before switching to isometric. Feel free to add small random movements to help you work through restrictions as you go. Progress from seated to standing, then standing with an arm straightened overhead, to holding a small weight, to holding a heavier weight. Take your time with these progressions. Keep your lower body locked into place and avoid letting your hips push out to counterbalance your tilt. Using a wall can also help you stabilize your form and give you a target to reach out towards. Number 3, circling. Circling, or circumduction of the spine, is a compound movement that uses virtually every muscle in the core as it stabilizes the spine through flexion, extension, abduction, and adduction. This has carryover to almost any sport while also being one of the best tools in joint repair for general spine health and function. Circling is best performed from a wide standing position. After clenching butts and guts, begin moving in slow, small circles at first, being extra cautious as you move through the back end of the circle where your lower back is under the most pressure. Keep the hips locked into a neutral position. We want to isolate movement of the trunk and not look like we're doing hula hoop. Change direction after each full circle and progressively expand the range of your circles as you go, but be ready to go small again if you start running into sharp pain or high levels of tightness and restriction. Progress circles by adding a small weight at first, and once you've built up a good tolerance to slow movement, you can experiment with a slightly increased tempo to reach fatigue faster. Number 4, hanging, specifically active hanging. Active hanging has a ton of benefits, but the big 3 are grip strength, shoulder stability, and spinal decompression, which is our focus in this video. Now, I can already hear some of you out there going, "But Sean, I don't have anywhere to hang from. What do I do?" First, calm down. Second, you don't need any special equipment to hang. You just need a stable object to grab onto, like a countertop, desk, or doorway. Use one arm to grip the object firmly and begin leaning away. Do this with a wide stance at first for extra stability, and brace your free hand on one leg or another part of the object. As you lean away, feel tension spread through your rib cage and into your spine. Once you have a light to moderate amount of tension, stop and begin moving around from this position for a few seconds. Don't overthink it. Just move around and feel for spots of increased tension or resistance from the spine, hips, and shoulder blades, and gently move into them, not away from them. Come out of the hang every 10 to 15 seconds, shake off, and switch to the other side. Do this 3 or 4 times, probing deeper into your most restricted areas each time through. The key to active hangs is in the first word, active. Resist the temptation to relax into the stretch by keeping your extended arm firmly clenched. A good active hang should feel like any other mobility drill in that you feel both stretched and a little bit tired by the end of it. That's it. Spending just 5 to 10 minutes a day, every other day with these movements can start chipping the rust off even the stiffest spines. Enjoy.